Hi, and welcome to the Vet Dental Show. I'm Brett Beckman, board certified veterinary dentist, and we come to you every Wednesday as veterinarians and technicians in general practice to get you to the point where you are the best you can be in general practice dentistry. 5 episodes, we're going to be transitioning to pain management, and we're honored to have Dr. Mark Epstein, veterinary pain management expert, medical director at TotalBond Veterinary Hospitals in North Carolina, and a certified veterinary pain practitioner to join us here. He's a diplomat and past president of the American Board of Veterinary Practitioners and a past president of the International Veterinary Academy of Pain Management. Dr. Epstein also co chaired the AHA and AAFP pain management guidelines, led the AHA Senior Care Guidelines Task Force, and was awarded the 2022 Vitica Small Animal Educator of the Year Award at the Western Veterinary Conference. So Dr. Epstein recorded these in a live workshop back in 2023, so they're all very recent. All 5 episodes are categorized based on the agent. They are brief for a reason because there's a lot of information in each one. So please sit back and enjoy Dr. Mark Epstein.
Hi, everyone. Mark Epstein here, and we're ready to cover our supplemental section. A lot of updates since some of the other stuff has been recorded. A little bit of review, but also a lot of new stuff. And so let me go ahead and get my screen shared here. There we go. So let's go ahead and get started. So this is the material that we'll be covering here today, and just a quick reference slide, but let's go ahead and get into it. Now, I had previously shared the 2015 AHA AFP Pain Management Guidelines and the Global Pain Council World Small Animal Veterinary Association guidelines came out about the same time. Both of these documents have since been updated, and they are open source. I would advise you to get it, download it, but a lot of the material that we have covered here over the last number of weeks really does include the meat, the bone, the flesh of these two documents, and particularly when it comes to recommendations for therapeutics. Let's go ahead and cover some data points of literature that's going to come out just around that same time, maybe even a little bit since. And this was kind of a capsule summary. I had mentioned the data that supported the use of low-dose meloxicam, 0.02 milligrams per kilogram, and then standard doses of robenacoxib or Onsior for degenerative joint disease, osteoarthritis in cats over a period of time, even if they were to have chronic kidney disease, both the efficacy and the safety of that. And this capsule summary really puts it all together. And then the World Small Animal Veterinary Association took that, more or less, and put it into this. They will go kind of out of their way to recommend using NSAIDs at the lower dose of meloxicam, 0.02 mg per kg every day, and maybe a standard dose of Onsior every day to every other day under the following conditions. Number one, that the iris 1 and 2, 3 is a little less certain, but not 4, and that the chronic kidney disease is stable. That means over a 2-month period, BU the same, creatinine the same, blood pressure the same, proteinuria the same. Make sure that hydration is maintained, whether it's by management at home and encouraging water intake and wet food and so on, or sub-Q fluids in fact, and to taper to the lowest effective dose and frequency. Generally, that's going to be going to every other day, maybe even every third. Remember that NSAIDs are highly protein bound. They will go to the site of inflammation and reside there for quite a period of time, longer than the plasma levels. So with that in mind, we've got a good rationale to use it under these circumstances. And in my practice, we certainly have. This study came out just a little bit after that capsule summary, and it does give you this one little bit of caution, and that with this low-dose meloxicam schedule, that over time, that they ended up having a little bit more proteinuria. And so we do want to monitor, make sure that that is part of the monitoring process, urine protein creatinine ratio, in addition to your BU and creatinine, and so on. Moving on to some other information. This is in the realm of grapiprant or galoprant, the EP4 receptor antagonist. And we have questions, there's some pharmacokinetic work done in cats, whether or not it has an analgesic effect or not, open, and whether or not we should be using it in the kind of the post-surgical pain versus just osteoarthritis is an open question for both dogs and cats. And then cats here, the answer is pretty much nope. Doesn't seem to have a benefit. So we'll stick to, carprofen, the classic, or meloxicam, Onsior. We'll stick to the classic COX-inhibiting NSAIDs for post-op analgesia. Staying with Galliprant for a little bit, it turns out that just from a safety standpoint, that collies and others that express the MDR1 gene, it's okay with them. We don't have to worry about that. And that this EP4 receptor at which it binds is a marker that upregulates in cancers, particularly osteosarcoma, squamous cell carcinoma, and anal gland carcinoma, adenocarcinoma, not in transitional cell carcinoma. So you wouldn't want to use it in place, for example, for piroxicam for uroepithelial carcinoma. Does it have an anti-tumor effect? We don't know. Can it help minimize pain? Don't know. But with that in mind, there's the data. More to learn over the coming years. Moving on to opioids a little bit. Symbidol is labeled for cats, of course, for 24 hours of post-surgical analgesia. And there are some pharmacokinetic data and some pharmacodynamic data about using it in dogs. Now, the study on the left here is pharmacodynamic. In other words, it was used to see, can it work equally well to our standard formulation of buprenorphine, that is Buprenex in the US and Veteragesic in other parts of the world, given at, again, the standard dose of roughly 0.02 mg per kg. And the answer here was yes. I do want to point out that it was given intramuscularly in dogs. Symbidol was given intramuscularly at 0.02 mg per kg, and it had the same effect postoperatively as Buprenex or Veteragesic. So seems it can be used extra label in that regard. It was kind of non-inferior. Now, this next study is pharmacokinetics, just looking at how long it lasts in the plasma concentrations. And recall with cats, at least personally, I'm in the habit of dose reducing from the label dose of 0.24 mg per kg sub-Q down to 0.12 mg per kg sub-Q. And we seem to get roughly the same benefit without some of the adverse effects, for example, of behavior change or inappetence. So the question is, can we give it to dogs at that level? And pharmacokinetically, it seems to be the same. Pharmacokinetically, it seems to be the same. I will tell you that experientially, we still get in dogs at that level a little too much of the behavior change and dysphoria, maybe inappetence. So I am in the habit of lowering it even further in dogs. And we give it sub-Q, but whether it works as well sub-Q or should I be giving it IM, I don't know. But we will use it. And if you're going to ask me, do we get, the mere 6 hours like we do at 0.02 mg per kg? Do we get the 24 hours that we would hope to get at 0.12 or way up to 0.24? I don't know. I do think it's probably in between that. So 12, 18 hours, maybe if we're lucky, the 24. Very hard, of course, to assess it for sure. It's going to require some controlled studies to do that. But in our practice, we have gone extra label, and we'll use Symbidol in a replacement of our buprenorphine, that's Buprenex or Veteragesic standard formulation, over to Symbidol sub-Q 0.08, 0.09 mg per kg. And we find that to be both effective and without too much in the way of adverse effects. So moving over to this new longer-acting buprenorphine product, and that's Zorbium in cats. I'm going to go ahead and go out of my way to say I would not use this in dogs. It is effective for cats for 4 days of post-surgical pain. And because the skin of the cat and the skin of the dog is much different, I just wouldn't even be tempted to use it in dogs. The whole idea here is that it goes into the stratum corneum of the skin. So the stratum corneum is like a brick and mortar layer. The brick are the cells, and the interstitium is the mortar. And it goes into that interstitium, and then from there, it kind of weeps in, if you will, to circulation, where it's then metabolized out. We do want to make sure that we're wearing PPE, gloves, lab coat, face shield, and so on. And again, it has a very good predictable effect for 4 days of analgesia. This is probably not for every cat. For example, not cats with lots of comorbidities. You want to dose on lean body weight, so that's going to be a factor. And, I don't use it for these, patients that have low surgical dose. This is for patients that are undergoing more significant pieces of surgery where the post-op pain is going to be more predictable. Some examples here include the soft tissue sarcoma resection that you see on the cat on the left. Cat on the right came in with trauma, abdominal hernia, Salter fracture there on the right tibia. And we stabilized this cat, but once stable, we went ahead and administered Zorbium to this kitty until we got around to surgery. The cat in the middle has squamous cell carcinoma, and if this is going to be completely excised to make sure it doesn't eat away at this cat's face, it's going to require nasal plenectomy, and this cat also received Zorbium postoperatively, along with the other layers of multimodal analgesia. So just quickly comparing these different opioids that we have, I want to reiterate that Symbidol is labeled for cats, not labeled for dogs. We have some data about using it extra label in dogs. Zorbium is labeled for cats. I would not be using it in dogs. The Bup SR is used in cats and they're sometimes used in dogs, or some people are using it in dogs, not labeled by the FDA. And it's a different kind of a phenomenon. It's actually got a matrix, a polymer in there that as it dissolves, it releases the buprenorphine over a long period of time, and very little data that's out in the public sphere. Most of it all is proprietary. And just keep in mind that even the buprenorphine standard formulation that we've been using for so many years is not labeled for cats and dogs either. And keep in mind that the kind of the technique of putting it into syringes and squirting it into the mouth, number one, it's considered compounding, and the FDA is not charmed by that. You are putting opioids into the hands of people, so there's that potential problem as well. And just it doesn't have the bioavailability that we once thought that it did. It's about 50%. So with that in mind, personally, I would advise sticking to, Symbidol and Zorbium in cats. And if you wish to use the Symbidol in dogs off-label, there are some data to do that, but I would not use that off-label for dogs. Use Zorbium off-label for dogs.
I hope you enjoyed this episode. There's a lot of actionable items in there that you can take and use in your practice immediately. So put those to work and enjoy the benefits for the practice lifetime in your dentistry service. So until next week, have a great week. Take care, guys.